In my culture, to live a full and healthy life, you need to be in balance physically, mentally, spiritually, and emotionally. When I moved to Calgary as a recent graduate, I was excited for all the possibilities the city would offer. I started volunteering and was offered a great job within an Indigenous organization that allowed me the freedom to access my culture and incorporate it into my practice. One night, after I got out of the shower, I noticed the starting of a rash. I had experienced something similar a few times after I had gotten my tattoos. At this time, I had spent 20 minutes being unsympathetically lectured by my previous family doctor for the personal choices I had made about my own body. When the rash started to worsen over the next few weeks, I decided it was time to visit the clinic. The doctor I saw seemed new, unsure of herself, and uncomfortable, but I explained to her my symptoms and what I thought it might be. She did some tests and told me I would be contacted if there was a positive result. A week of silence was a welcome relief, but the rash wasn't going away and the medication she prescribed wasn't helping. Whatever was happening was starting to affect my self-esteem and my relationship with my partner. Finally, I got a call from the clinic, but it wasn't what I was expecting. The doctor had mislabeled the test and I would need to go in again. I saw 5 other healthcare professionals who poked, prodded, prescribed, but ultimately failed to give me any clarity. It wasn't until the last doctor I saw that it was suggested I get a referral from my family doctor to a dermatologist. I was feeling fatigued, I couldn't sleep, withdrawing from my relationships. I noticed my emotional state was affecting my ability to work, and I lacked the social supports I had back home. The thought of having to search for a family doctor just to get a referral when all this was happening now was a daunting task. She handed me a business card that would help me in my search and explain the importance of being able to follow up after the specialist. I managed to find a family doctor on my first try who took the time to listen to my physical symptoms, but also recognized the emotional and mental toll this process was taking on me. I walked out of her office with 2 referrals, one for a dermatologist and one for a psychologist. After struggling for 4 months without answers, I now had to wait another 2 months for my appointment. I decided to seek out advice from an elder. I told her about what was happening and how it was affecting me. She listened patiently and shared her story with me. I took that story to a nurse later that week and was able to get a possible diagnosis. I felt a huge weight had been lifted off me. The elder had given me peace of mind, reassurance, and reinforced my spiritual strength. When I finally was rushed through the dermatologist's office a month later, I was in a much more balanced place. I was grateful to have an encouraging family doctor who I can follow up with, ask questions, and explore my options.